everyone, today we'll be presenting on the CELF-4 Spanish edition. So, just to get us started, we'll be presenting our KWL chart, key test information, uses of the CELF-4 in Spanish, administration and scoring information, as well as levels of the CELF, usefulness for ELs, and the evidence-based practice related to the CELF-4 in Spanish. So let's get started. So for our KWL, what we knew was that it's a standardized assessment, it's used to assess language in children, and it has been translated to be used among Spanish speakers. What we want to know are specific components and subtests within the CELF-4, usefulness in identifying language disorders among English language learners, and what the evidence says about the CELF-4 Spanish edition. And what we learned is that there are 16 subtests total that encompass various components of language. The CELF-4 helps pinpoint strengths and weaknesses of English learner students in order to allow for accommodations of these students. And lastly, that results should be interpreted with caution for diagnosis of language impairment. So some key test information and measures include that it's a standardized tool to identify, diagnose, and follow up the evaluation of language and communication disorders in Spanish children. It's normed for ages 5 to 21. Subtest administration depends on age, and administration of these subtests usually takes about 30 to 40 minutes. And so now, talking about the test, it has a core language score, a receptive and expressive language index, a language content and structure index, a criterion reference pragmatics profile, an observational rating scale, and as I mentioned before, there are 16 subtests total.
So as you can see, the CELF-4 is a standardized language tool used for Spanish-speaking children and young adults, and it serves a multitude of different functions. So the most important function of the CELF-4 is that it helps determine whether or not there is a language disorder. This data can in turn be used by speech-language pathologists to help the children get eligibility for speech and language services if need be. The test breaks down the scores into expressive language and receptive language, so you can see where the strengths and weaknesses lie. It also further breaks it down into more specific categories of morphology, semantics, and syntax. So the test helps determine also, it's a unique feature of the CELF-4, is that it helps determine cognitive and linguistic issues that may be affecting language, such as working memory. Lastly, the test can be used to measure progress. So every 6 to 12 months, the test can be retaken to match their age-appropriate levels and grade levels to see if treatment is working and if their language is progressing.
Now I will be talking about the administration of the CELF. In order to administer the CELF, you will need a quiet room with the record form, the stimulus manual. The stimulus manual has detailed instructions provided inside on how to administer the CELF. It gives examples and trials for the student, and this is what one looks like. It lays out the expected answer and acceptable variations. Additionally, a questionnaire is provided for the student, parent, and teacher to complete regarding the student's communication in the classroom. The CELF-4 in Spanish can be completed by the SLP, the school psychologist, special educators, or trained diagnosticians. In order to administer the CELF, the administrator must have native or near native proficiency in Spanish with no hesitations or mispronunciations. If this is not the case, the administrator will need to collaborate with someone who is qualified to administer the CELF. It's also important to have knowledge of language acquisition, specifically second language acquisition, because it's important to know if the scores are turning out a certain way due to a true language disorder or a language difference.
Now for scoring, each item in the subtest gets a score of 2, 1 or 0 depending on the student's performance. If a subtest is discontinued due to the student's inability to perform on it, then the last item that gets a score of more than 0 is considered as the ceiling. CELF-4 Spanish provides core language scores and index scores. Index scores are calculated by summing the scale scores of subtest which measures similar language features. This is how the scoring sheet looks like. So for the core language, the first 4 subtests are scored together, and then depending on the language features, rest of the subtests get their raw scores which are summed up so that we can have the scale scores. Once the scale scores are entered in this section, then they are compared to the normed data for percentile ranks and age equivalent scores. In the end, you can compare it to the standard norms to get the composite score, and then which is presented in a visual chart so that the student's performance on each of the language features can be visualized.
The CELF-4 Spanish provides scores on 4 different levels listed here. It provides in level 1, which is the core language score. Then you're going to look at expressive and receptive language. Then you're going to see the underlying clinical behaviors, which is like working memory. And then lastly, you're going to see classroom performance, how the child deals with the curriculum. The scores provided are standard scores, percentiles, confidence intervals, and composite scores. So once the child is identified as having a language disorder in level 1, then it's warranted that you should complete the subsequent subtests so that you can see where the disabilities actually lie. So the CELF-4 Spanish is a parallel version of the CELF-4 in English, and it has been changed to fit the cultural and linguistic differences in Spanish.
The CELF-4 in Spanish is useful for determining if the student is struggling with basic interpersonal communication skills or cognitive academic language. It's also useful for identifying strengths and weaknesses in the student's language. It's also useful for SLPs and educators to identify appropriate accommodations that may need to be set in place in order for the student to be successful in the classroom.
So for the evidence-based support on CELF-4 Spanish, there was limited research that we could find. Bargan et al. In 2018 did a study which included 656 students in the age of 5 to 8 years. These students were Spanish-English dual language learners from low income and low parental education backgrounds. They were attending English-only schools. So the study compared the performance of this population to the normed sample scores. They compared the core language scores of the norms with this population. The results indicated that the low-income Spanish-English dual language learners got a score that was more than 1 standard deviation above the mean. So the authors in their conclusion indicate that the low language abilities of this population should be attributed to the fact that they have a relatively low family linguistic environment when compared to students who come from a high SES background. Thus, they suggest that for getting the actual accuracy of how the low income Spanish-English dual language learners actually perform, they should have separate norms for this kind of population. Also, when they examined the accuracy of identifying language impairment in this population, the author suggested that CELF-4 Spanish tends to over-identify. So in the study, it reported that 1/3 of the children which were included in the study were over-identified if they were only classified as language impairment based on CELF-4 Spanish. Thus, they recommend that it should be used with caution, and the clinician should look at the other factors before determining whether or not bilingual children have language impairment. Another study done by Pedro and Peña in 2008 identified issues in sensitivity and specificity criteria for the CELF Spanish. So they basically did an analysis on different assessments which are used for identification of language impairment in bilingual children. In those assessments, they included an analysis of CELF Spanish, and then they found out that the CELF Spanish did not meet the classification accuracy for sensitivity and the specificity criteria, whereas the CELF English did. A general feature that they pointed out in their study was that children who are bilingual tend to have a smaller vocabulary, which often is considered as a language impairment. However, they made sure to point out that small vocabulary is often just a typical trend seen in when the bilingual children are developing their language. However, they did point out that grammatical morphology is one thing that the clinicians should stress on during identification of language impairment, since it is a more accurate feature that can help you in identifying them truly rather than under-identifying or over-identifying them. And they suggest that the CELF Spanish is a good test that can be used for identifying the features of in particular features in the language which needs to be worked on. However, it should not be used in isolation or alone. In identifying language impairment, the clinician should make sure that they have knowledge of the normal language development seen in bilingual children, what is the difference from monolingual, to make sure that they are not over-identifying or under-identifying language impairments in these children. Moving on, these are our references. Thank you.